Are you someone getting ready for your nursing interview to move abroad in countries like Australia, US, Canada or UK? Then this video is for you. Hi everyone, this is Jason from Medilogics, where we provide you all the information you need to start your career abroad. In today's video, I am discussing about the very important topic, how to prepare yourself for a nursing interview to move abroad. Whether you are a recent graduate or an experienced nurse, this video will help you stand out and secure your dream nursing job. The interviews for nursing positions abroad are very different from the interviews that you must have attended in your life till now. For instance, in India, my interviews were focused on understanding whether I have the required skills and technical knowledge to become a nurse. And mostly questions like, can you explain how to do a Ryle's tube feeding, are asked in the interview. However, for interviews abroad, they are mostly focused on understanding whether you have the right attitude and whether you are a good fit for their team. Behavioral aspects, teamwork, communication and critical thinking are the components that you are tested on for the interviews when you try to move abroad. The tips I'll share today will apply to both face-to-face as well as an online interview. So make sure to watch this video till the end. Let's start this video by breaking down the parts of an interview. The first stage is called the introduction stage. This will last about 3 to 5 minutes, and here the hiring manager will greet you, welcome you to the space and maybe do a little bit of small talk just to establish rapport with you. Make sure you're addressing your interviewer with appropriate title like Mr., Miss, Doctor, or if the person has told you that they prefer being called by their first name, then do so. If you're going for a face-to-face interview, they might extend their hand for a handshake, and I know it can be very awkward in many situations. All you need to do is perform a brief and firm handshake. Then the interviewer might discuss about the job position briefly and will provide you a bit of information about the organization. The second stage is called the question stage. This section will generally begin with something like, tell me about yourself. This is your chance to make a strong first impression without giving too much of your personal information to the interviewer. Make sure to keep your answer concise, and I suggest something like a present, past and future pitch. You can draft your answer something like this. In the present form, you can explain what you are currently doing. In your past, what you were doing before this role or your qualification or the experience that you have. And in the future section, you can talk about your goals, your aspirations that are there. For example, you can say something like this. First of all, thank you for inviting me in today's interview. I am Jason Joy, a registered nurse with 5 years of experience in critical care at All India Institute of Medical Science, Delhi. I recently completed my licensing procedure with APRA and I'm excited to find my first nursing job in Australia. In my current role, I provide high quality nursing care to my patients in collaboration with my team. I am passionate about critical care sector and hence I have pursued a specialization in this field. I am excited about this opportunity as it perfectly aligns with my goals and aspirations to build my career as a critical care nurse in Australia. After this tell me about yourself section, they will follow up with lots of behavioral questions and I will explain you how to answer those behavioral sections in the video ahead. The next section of your interview will be where you will be provided the opportunity to ask questions. Interviewers expect candidates to have questions. If all the questions that you had were answered, then in that case, thank them for their time and tell them politely that you do not have any questions. But I highly recommend that you prepare some questions before the interview. You can ask something like this. Can you tell me a little bit more about the on-the-job training that I will receive if I join as a registered nurse in your hospital? The last section of the interview is the conclusion or the closing stage. Here, the interviewer will tell you about the further steps and when they will contact you and how they will contact you once they have made the decision. Here, you must thank the interviewer for their time and consideration. Now, when you have the understanding about the various parts of the interview, let's move on how to prepare for the interview. Most fundamental point or the number one point I would like to tell you is do your research. Thoroughly research about the organization, their value system, their goals, the kind of services they offer, and specifically the job position, the description of the job position and the selection criteria so that you're fully prepared and understand whether you are the perfect fit for this job or not. The next preparation that you must do is answering the behavioral questions, and I can tell you from my experience, I also did not know anything about this section when I came to Australia. I also learned by making mistakes, and I'm sure watching this video will help you avoid those mistakes. So let's first understand what are these behavioral questions. The behavioral questions are focused to understand you as a person, your personality, whether you're able to work with others collaboratively or not, your critical thinking skills, and your soft skills per se. To answer any kind of behavioral question, I suggest you master the STAR method. The STAR method is nothing but S for situation, which means you describe the situation when you are answering the question. T is for task, which means explain the task that you were responsible for. A is for action, what actions you took at that particular stage. And R is for results, or the outcome of that event. Let's look at an example so that you understand this technique better. One of the very common behavioral questions that we generally see is, describe a situation where you had to work with a difficult co-worker. How did you handle it? So now let's see if we can apply the STAR method here. I'll first explain the situation. In my role as a nurse, I once worked with a colleague who used to always contest my decisions in front of doctors. This situation created an unwanted tension between me and my colleague. It also undermined my professional credibility as a nurse. Let's move to the task. My task was to address this situation professionally so that I can ensure that my patient continues to get the most proficient nursing care. I'll explain the actions that I took now. Initially, I tried to ignore it, but then I decided to discuss this matter with my co-worker. I approached my co-worker in a calm and quiet environment and clearly explained her how her actions were making me feel. During my discussion, she also opened up and told me that she feels that doctors prefer my decisions over her. I listened to her carefully, acknowledging her feelings, and apologized if she ever felt like that. We agreed on better communication moving forward, and after conversation, the tension between us resolved. We were able to work again together as a collaborative team and ensured our patient receives the best nursing care possible. So from this example, you can see I explained the specific situation, and then I explained what was the task or what was my goal in this situation. I also explained the actions that I took and what was the outcome or the result of that particular situation. Let's take another example. Tell me about a time when you supported a patient through a challenging diagnosis or procedure. How did you handle that situation? Last year, when I was working in the chemotherapy unit, I had a patient who was 12-year-old who was diagnosed with acute lymphocytic leukemia. It was her first extended stay in the hospital and she was very anxious. Understandably, she was very nervous about her first chemotherapy and unfamiliarity with the hospital settings. My goal was to calm her nerves, support her in her journey, and also to answer any questions that she has about the procedure. I ensure that I provide very strong emotional support to her before, during, and after the procedure. I built rapport with her by listening to her interests and things that she likes to do. On the treatment day, I brought some activities for her to distract her and involved her parents for comfort. During the chemotherapy infusion, I stayed by her side, held her hand, and tried to talk to her and distract her as well. I administered the medication effectively and also kept a very good vigil to ensure that she does not have any side effects. After the session was over, I regularly checked on her and made sure that she is comfortable with her family. She and her parents gave me very positive feedback and explained to me how they felt comforted and supportive during this difficult time that they had. So again, from this example, you will be able to see that I arranged my answer in the STAR method, that is, explain the situation, the task, and the action, and what was the result or the outcome in this situation. Some of the other common behavioral questions that you might have are, describe a time when you had to deliver a bad news to a patient. How did you handle the situation? Can you tell us by examples how you were able to improve the processes in your unit? Okay, so I hope I was able to shed some light on the STAR method. I highly recommend that you go through multiple behavioral questions for your interview, write suggestive answers when you're preparing, and practice practice answering them in front of a mirror. Some other bonus tips from my side: if you're going for a face-to-face interview, make sure that you dress very professionally. A business suit or a pants and formal shirt will be a perfect fit for your interview. Be on time. Punctuality is essential. Smile. A smile goes a long way. Establish a good rapport with your interviewer. Maintain eye contact and a good posture. Project a positive attitude and enthusiasm so that they know that you are excited for this position. Be a good listener and avoid interrupting. Prepare questions for the interviewer to show genuine interest. Don't bring up salary or benefits unless they mention it, and be prepared for a truthful response if you're asked. If you're applying for your first nursing job in abroad, then I would suggest that research the hourly rate based upon your experience and be truthful and honest to your interviewer. For online interviews, I highly recommend that you still dress very professionally. Sit in a place where you have good lighting and a white background. Make sure that the environment is quiet so that you can communicate with your interviewer effectively. Test your mic and other equipments beforehand so that you are fully ready. After the interview, once you reach home, make sure to send them a follow-up email with a thank you note and thank them for their time, and once again tell them that you are excited to hear from them. So there you have, my friend. I have covered the most important tips and tricks, including the STAR method, for you to prepare yourself for that perfect interview. Remember to breathe, stay calm, stay honest, and showcase your best skills forward. I hope you found this video useful. If you did, don't forget to share it with your friends and give it a like button. Also, please subscribe to our channel. I'm sure you will get lots of useful information for your career here. Until next time, stay safe and stay happy.